How does cancer pathology determine your specific cancer type? Imagine your body as a busy city with many different neighborhoods. When something goes wrong, like a building starting to malfunction, specialists need to figure out exactly what type of problem it is. That's what cancer pathology does for your body. It looks at tissue or cell samples from your body to find out what kind of cancer you have. The process starts with a biopsy, which is like taking a small piece of that problematic tissue. Doctors use a thin needle or a small surgical procedure to get this sample. Once they have it, the sample is carefully preserved and prepared in a lab. They slice it into very thin layers so they can see the tiny details under a microscope. A pathologist, a doctor trained to study tissues and cells, then examines these slices. They use special dyes like hematoxylin and eosin to stain the cells. Hematoxylin makes the cell nuclei appear blue, and eosin colors the cytoplasm pink. This coloring helps the pathologist see the structure of the cells clearly. They look at the shape, size, and arrangement of the cells to tell if they are normal or cancerous. But it's not just about what the cells look like. The pathologist also performs additional tests to find specific markers on the cells. These markers are like flags that tell us more about the cancer. For example, some tests detect proteins or genes on the surface of the cells. These details help classify the cancer more precisely. For instance, they can tell if the cancer is a carcinoma, which starts in the lining of organs, or a sarcoma, which begins in connective tissues like muscles or bones. The pathologist then writes a detailed report. This report describes the type of cancer, how aggressive it looks, and how far it has spread. This information is vital for your doctors to decide the best treatment plan. Knowing the exact cancer type helps them choose the right surgery, chemotherapy, or radiation therapy. Understanding your pathology report can help you see what kind of cancer you are dealing with and why certain treatments are recommended. It shows that your diagnosis is based on careful, detailed examination of your tissue. This process makes sure you get the most accurate diagnosis and the best possible care. In short, cancer pathology determines your specific cancer type by collecting a tissue sample, preparing and staining it, examining its cellular details under a microscope, and performing special tests to identify markers. All these steps come together to give your doctors the clear picture they need to treat your cancer effectively.